sexual activity is something everyone should enjoy. Everyone that is having sex should enjoy it and have pleasure from it. But unfortunately, some people experience pain during sexual intercourse, both for the men and the women as well. So, but it is found out that it is more common among the female folk. Okay, now if you're a woman, you can experience this pain at the opening of your vagina just before you enter in, then as you go in into the vagina at the vaginal walls, then in your womb, as well as the muscles that hold the womb together. You can also experience it on the outer surface, that's the vulvar region. Now, for the men, they experience this at the head of their penis or at the shaft of their penis and at the scrotal region. Yes. So now, if you belong to this category, I don't want you to worry so much because on today's video, I'll be dissecting and telling you the things you need to know about this pain that is surrounding sexual intercourse. I'll be telling you what could be the possible causes so that you will know what could be the cause in your own case, then some treatment options or one or two things that you can do to alleviate this challenge. I am your happy host, Oluchimogo Francisca. On this channel, I talk about things that has to do with the female reproductive system, care of your newborn, and parenting skills. For some people, they experience pain since they became sexually active. That means since they became sexually active, that's when they started experiencing this pain. For others, this pain comes and goes. It comes and goes. For the other group, they were not experiencing pain at all. But after a long period of time, they started experiencing pain. So now it's good you know which category you fall in because you may be needing this to tell your medical practitioner. Okay, so now what are the causes of this condition? Like what can cause it? I will be starting from what I call the mild causes to the ones that I call the bigger causes. So now the first thing that can cause this is that you may not be lubricating well. Okay, you may not be so wet. For some people, they find it difficult to last long during foul play. Maybe your partner doesn't want to stay so long doing the play stuff, and because of that, they enter too soon or too fast or with so much roughness and all of that. This can cause friction and pain. Whereas for another category, it is an issue of dryness. You may be experiencing so much foul play and you'll feel like you're aroused, but you have this issue with vaginal dryness. In that case, I would recommend what we call a lubricant. Okay, lubricant that can help you. Actually, I'll be talking more about that when I'll be talking about the treatment to this little conditions. Okay, so now the next thing that can cause this is in breastfeeding. For breastfeeding mothers, you're going to be experiencing a lower level of estrogen, and estrogen helps in bringing out these vaginal secretions. So this is mostly common in the first 6 months after childbirth. So now if you're experiencing this, it is good you work harder to arouse yourself more before you get into the do. All right, so now the next point we're going to go to is what I call trauma to the vaginal walls or the perineal region. During childbirth, sometimes some of us can experience tear, some of us can have a episiotomy given to us. That's the cord that your medical practitioner gives to you so that they will help you deliver your baby or for any other procedure they want to carry out. So you can be given this cord. And now if you do not allow yourself to heal properly and you try to go, you are going to be making that area sore and you're going to be having pain. So these are what I call the mild cases. Now let's go into something that I call the medical and the deeper cases. The first thing we're going to be looking at in this group is vaginismus. Vaginismus is a condition whereby the muscles of your vagina tend to be so stiff involuntarily, like you are not the one causing it, you're not the one trying to do it by yourself, but involuntarily they tend to become stiff, tightened up, and they are like as if they are afraid of something. Now vaginismus usually come maybe because you are not comfortable with that sexual partner, or you have an experience, a bad memory of sex, or you are just nervous and all of that. So vaginismus is always there when you are not psychologically and emotionally balanced, when there is high level of cortisol in your system due to anxiety and worry. Okay, now if you have vaginismus, there is going to be difficulty in penetration, as well as there is going to be pain accompanying it, because there is going to be friction. Since that place is tensed up, since there is so much tightness, and since there is not enough lubrication. The next cough we're going to be looking at is pelvic floor dysfunction. For some people, after giving birth, they find it difficult to, move their pelvic muscles well, or maybe you just have issues with the muscles of your pelvic floor or the ligaments and all of that. You may also experience pain whenever there is this associated sexual activity. Another possible cause could be in premenopausal women or women that are approaching menopause, simply because their estrogen levels drop and they find it difficult to be well or properly lubricated during sexual intercourse. There are other causes that I'll be listing, and we have something like dermatitis, when you have skin infections that can affect your genitalia. We also have bowel issues, when you have issues with your digestive system, issues with your urinary system. These things can actually affect the pain level, or you even having pain at all during sexual intercourse. Now let's quickly go to the treatment options. The first thing I want you to know is that you have to be ready for the sex whenever you want to have it. That way you can always feel aroused. That way there will be no need for anxiety. That way there will be no need for undue nervousness and all of that. And this is actually the solution to vaginismus and people who do not play so well before they go into the main thing. All right, so you need to be able to play well so that you can bring out more secretions. Now the next thing we have to look at is lubricants. There are lubricants that can help to moisten up those areas. We have water-based lubricants and silicone-based lubricants that are medically certified and that you can use in your vagina before sexual intercourse. I have a video that explains how you can take care of your vagina and your vulva properly, so that you can avoid bacterial infections or even inflammation of the vaginal walls. So just check out that video, it is going to be of use. Now you have to avoid irritants, things that are going to make your vagina to scare, to flare up. We have stuff like people using highly perfumed soaps and all of that. No, that's not good in your vagina, so don't use them. Now the next thing is for women who are in their menopause. Sometimes the doctor is going to prescribe estrogen creams and all of that medicines that are going to help you. Now, if you have severe or more other severe medical condition, they are going to run tests for you, do pelvic examinations for you, so that they're going to know the best treatment regimen for you. Now, again, you have to also monitor the type of positions that are friendly to you. Like some positions are going to enable you to have sex without pain. So you check out those positions and then you can take them. Another vital thing is de-stressing ourselves. If you're stressed out, you're going to be having cortisol in your system. Cortisol is a stress hormone and it does not really do you well, because you're not going to be in the mood so fast for you to enjoy yourself. So you have to try to relax, to calm your nerves, to distress yourself, and to be in the mood. With this, I have come to the end of today's video. Please kindly like, share and subscribe, comment and ask questions, and I will fully attend to them. Bye.